Good morning, friends. A lot of my patients have been asking me I should post a video, something brief but very informative, clear, concise, comprehensive about pneumonia. There's a lot of talks about pneumonia going in the media now. Now that there's an epidemic reported in China, you know, when initially the COVID pandemic started in China, there was a lot of sensation about a very unusual kind of pneumonia that was not getting diagnosed properly at the time. Now there is again a talk that there is a very resistant kind of a pneumonia going in China in big cities. And apparently it's spreading to other countries as well. So people are concerned about this pneumonia. What is pneumonia? What is the symptoms? What causes that? How do you prevent it? These are the various things that we would like to enlighten you today. Pneumonia is nothing but a consolidation of your lungs. If you can imagine, we have a pair of lungs, right? Two lungs, right and the left one. And each lung has got a windpipe that goes all the way like the main stem of a tree, and then it kind of branches out. And the final branches, it ends in a cluster of like a grapes like structures, like a bunch of grapes. This is what we call alveoli or air sacs. To make you understand, if you can imagine like bubble pack, a lot of bubbles, right? And each bubble has got air inside that. That's the way our lungs look. But when you have a pneumonia, these bubbles, instead of getting filled with air, they get filled with mucus, pus, fluid, all kinds of secretion, inflammatory mediators, and those things. And obviously, when the air that you take in, which carries oxygen, it goes through the bubbles and goes through the finer capillaries, the blood vessels, and the oxygen goes into your blood. And the carbon dioxide comes back to the air sac, and then you breathe out. This is normally how we are able to maintain our oxygen saturation in our blood. But when the bubbles are filled with fluid, the oxygen is not able to diffuse through the capillaries into your blood, so your oxygen saturation falls and become breathless. I'm just trying to make it very simple now. Basically, an infection of the lungs which causes fluid collections and changes and inflammation in the alveoli or the air sacs is called pneumonia. So the pneumonia can be very acute infective process. When you talk about infection, it can be virus, it can be bacteria, or it could be some other atypical organisms. The most common infections are bacterial pneumonias. Bacterial pneumonia, there are many kinds of bacteria, and most of these bacteria are normally present in your nose and in the environment and sometimes in your skin. And when your immunity falls or the load of the bacteria gets very high, it starts infecting your lungs. The most common bacteria, we normally have some names for that, Streptococcus pneumonia, which is called a pneumococcus. That's the most common pneumonia which we can prevent with a vaccine, the pneumococcal vaccine. Then we have Staphylococcus, we have Bromonella catarrhalis, we have influenza, not the virus. Haemophilus influenza is the name of a bacteria that causes infection. And then Bromonella catarrhalis, and immunocompromised people, they can get a very serious infection due to some very unusual, it has got a very unusual name, and it's not a common infection also. We see it in cancer patients, immunocompromised patients and other things. And those infections also have to be thought of in special patients. Now, coming back to the virus, we got adenovirus, we got other respiratory virus, like respiratory syncytial virus, what we call RSV. The COVID virus can cause pneumonia. Influenza virus can cause a terrible pneumonia. So we have many kinds of virus that floats in the air, especially during winter months, which causes pneumonia. Another thing is, what starts like a viral pneumonia can get secondary infection with bacteria if your immunity is poor, and then they can get very, very sick. This infection can affect a small portion of lungs, just like a pneumonitis, or it can cause a lobar pneumonia, which means a complete lobe of the lung is involved in the pneumonitic process. So that's called a lobar pneumonia. Or it can involve extensively the whole lungs, that's called a bronchopneumonia. Okay? Many of the viral pneumonias are bronchopneumonias. Very rarely we have bacterial pneumonias that are also bronchopneumonias. And how do you prevent pneumonia? See, the most prevalent pneumonia which affects the elder population, which causes even death and serious disability, it's pneumococcal pneumonia, which can be prevented by vaccines. Initially we give one vaccine, which is actually what we call a conjugate vaccine. The common brand name is like Prevnar, maybe there are other brands as well. You give that, and after say about 6 to 12 months, you give them a polysaccharide vaccine, what we call a pneumovax. So initial conjugate vaccine followed by a polysaccharide vaccine should give you a lifelong protection against pneumococcal pneumonia. There are two things we should know. All age groups can be given these vaccines. Even children can be protected with the pneumococcal vaccine. And beyond 3 years, it's about the same dose that we give, same like adult dosing. And people should not think that this pneumococcal pneumonia vaccine is going to prevent them from having all kinds of pneumonia. It's not like that. It's very specific. It prevents you from getting pneumococcal pneumonia, which is a very serious infection. But you can still get a viral pneumonia, or you can get a pneumonia caused by some other bacteria. So it's not like a panacea for all cures. It is very, very specific. Viral pneumonias, most of them cannot be prevented. But what you can do is, you can have the flu vaccine, because that will prevent pneumonia caused by the flu virus, influenza A, H1N1, and then the other variants. All these things can be combined in single vaccine called a flu vaccine, which is given annually through this season. Starting from end of August, it has got protection against the next August. So these vaccines are very important. So how do you treat? This is for prevention. Most people don't really respect preventive measures. Most of them get sick and then they realize, oh my God, I could have very easily prevented. Recently I came to know of one of my staff's family member who got a terrible pneumonia, and then he has to spend a couple of lakhs of rupees. But all these things could have been prevented with a single shot of flu vaccine costing less than 2,000 rupees. This is it. And about the treatment, if you suspect bacterial pneumonia, you do a blood count, you do a C-reactive protein, and if it's possible, you do a throat swab and look for the respiratory virus and rule out virus process, and then you focus on bacteria, and then you treat them with antibiotics. Antibiotics are multiple, many antibiotics, but the most common antibiotics we use for most kinds of pneumonias are azithromycin, erythromycin kind of derivatives, doxycycline, levofloxacin, and so many other antibiotics. I don't want anybody to just go over the counter and just buy some antibiotic and start using it to treat pneumonia. Self-care of pneumonia can be very, very dangerous, because pneumonia brings its own set of complications. Pneumonia, if not treated, you can become very hypoxic. Your saturation can fall. You can get into terrible problems. You can go into multi-organ failure, and a lot of people have died of pneumonia. Every year, there is so much of pneumonia all around the world, even in developed countries like USA, and more than 50,000 people actually die of pneumonia related complications, even in USA. So we have to keep that in mind. Pneumonia is a common problem. It affects children, it affects the middle age, it affects the old age. So there is no age bar, and there are many things that can cause pneumonia. But the basic problem is there's an inflammation and swelling, an infection of the lungs, which causes a poor diffusion. It causes fever, it causes chills, it causes cough, it causes breathing difficulty, and it causes extreme fatigue. So many symptoms, and these are symptoms that are common for most infections. So it is very difficult to differentiate this is pneumonia. But a clinician with a lot of experience, a clinician who has been dealing with pneumonias for years, can very easily say that by just looking at the patient, oh, this man has got pneumonia, like that. So it comes with experience. So you have antibiotics, you have supportive care. Some of them need to be hospitalized. They may need to be given oxygen supplement. They may need some fluid supplement. They may need support to control the other problems that come with pneumonia. A fever, infection can come with fall in blood pressure, fall in liver function, fall in renal function. Those things can happen. So you need a supportive care, and some of them need an ICU care. COVID also caused a very severe kind of pneumonia, and many of them died because of severe hypoxia in COVID pneumonia. So these are the very basic factors that I wanted to tell about pneumonia. The most important thing, I would say that the take-home point is pneumonia can be very serious. Pneumonia can be prevented. If not treated adequately, pneumonia can kill somebody. Pneumonia vaccines are very effective. Everybody needs it, irrespective of the age. 2 doses are recommended. 1 dose now, and 6 months to 12 months later, the second dose. These are the very basic factors about pneumonia. If you have any specific queries, you can go to the comment section and ask, and I will make sure that all your questions are answered. So be wise, take your preventive measures, preventive vaccines, and shed the fear of disease and live a happy, robust life. Okay? Thank you.